infrastructure, buildings, facilities to provide care for patients. One of the main issues that I've had since I actually came back from Nigeria is that most of the people in leadership and governance in Nigeria, they do some sort of emotional blackmail. Okay? They let us, the average person, think that once you provide a building somewhere and you call it a hospital, automatically you actually provide. Okay, that's fine. That was just us in theater just doing a lumbar spine procedure. Next slide. So let's go to the meat. Okay. Okay. So that's just operating on a particular patient with a lumbar spine problem. Opening up now. This is just actually putting in those metal, those screws. They are actually not iron. They are not, they are titanium. So these patients can actually go through the scanner in the airport without any issue. They can do MRI scans as well. And that's it. We fix that. And then that's her about a week after the operation. Rolling down. Okay, next slide. So to the meat of the matter, teamwork. Okay, how are we able to do all these things in Nigeria, in this difficult terrain? Teamwork and collaboration is so essential for this. Okay, like I said, looking at those 6 pillars, the human beings, the healthcare workers, are very central to actually providing that care and actually creating that atmosphere of teamwork and what I call enhanced communication will definitely help. Okay, has anybody heard of relational coordination before? I call it ROC for short. Relational coordination is just it's a paradigm, it's a concept where you're looking at actually trying to integrate task of the people in a particular organization to actually make things easier and actually improve outcomes and stuff like that. One of the key things within teamwork is that everybody needs to do their job description. I keep telling, anytime I'm on TV and I'm being interviewed, if someone is actually interviewing me tomorrow, and she said she wants to talk about the issues that doctors go through in Nigeria, especially in public hospitals. I'm like, man, no, it's not just doctors. Healthcare provision in terms of healthcare workers is not just about doctors. Can we please move from that? All the other healthcare professionals who are not doctors are extremely important. Guess what? When I was a house officer, and when I just graduated from medical school, I thought doctor, I'm a doctor. It's like, oh, it's nurse. Until I moved to the UK. And I saw the importance of nursing care, physiotherapists getting involved, biomedical scientists, and stuff like that. Extremely important, okay? But one of the things in terms of this interdisciplinary, okay, you need that multidisciplinary approach as well. So, but everybody should do their job description. But the key thing about teamwork, who has seen an orchestra before? You should see myself and my team in theater. We're like an orchestra. You understand? Everybody knows what they're doing. It's almost like playing an orchestra with the violinist and stuff like that. That's what teamwork can do for you. So everybody should know their job description. But even in that job description, there will be interface. You understand? There will be that smooth interface now and again. Of course, the multidisciplinary approach is extremely important. I just looked after a baby, a 1-year-old baby that's head is so big, and I was really angry with the parents. Why did you let the head get so big? She has hydrocephalus fluid in the brain. Okay, why did you let the head get so big? And when I admitted the patient, I went to the pediatricians and I said, hey, I'd like you to be involved. I'm not a pediatrician. You know more about the drugs than me. When you calculate the drugs and stuff, they're like, well, you're a surgeon and you should be able to calculate the drugs. And I asked the lady, the pediatric resident, if this was your baby, would you like a pediatrician to be involved in the care of this baby? Will it be better for the child? Of course it will be. Of course. Of course, when I asked her that question, she didn't have an answer. Okay, this is so important. One of the fundamental problems that we have in Nigeria is our communication skills. When I got to the UK, for the first 6 months, everything I was saying, communication skills. I was like, man, I'm pulling my hair. What's up with all these communication skills? And then I moved back to Nigeria. No wonder, is that what they meant? Next slide, please. Okay, so I talked about this regional coordination. Like I said, it's communicating for task integration. To actually improve the output of what you're doing. And then it has 2 dimensions, the communication dimension and the relationship dimension. Okay, communication. When you have people working properly in a team, they frequently communicate with each other. So I'm telling you, it truly helps when you talk about patient-centered care and actually delivering care to that last man, to that patient, understanding that the patient is the center of everything. I was interviewed by one of the ladies in ASO TV, and I asked her, so who do you think, looking at all the players within healthcare, who do you think is the most important? And she was like, the nurses. I said, the patient. guess what? We are all potential patients. None of us will actually leave this plane without going to hospital at some point and getting sick. So usually, like for example, the enemy guys will say, you know, we're fighting for our welfare. I say, oh, you do fight for your welfare. Whenever I'm talking about healthcare, I think first about the patient, not about whether I'm a doctor or not. So you can call me what? A patient advocate? Okay, whatever. Okay, frequent communication is extremely important. Timely communication, especially in my line of work. You talked about critically ill patients. Time is brain. Time is spinal cord. I talked about the lady earlier on who had an accident and we try to move her into theater at least within 48 hours. One of the, especially within my field of work, one of the major problems is that the way God has created us, our brain, our spinal cords, the nerves that actually supply the rest of the body are all permanent tissue. Once they are damaged, it's difficult for them to recover. Difficult. So, but generally, I'm just using that as an example, but even in other fields, in pediatrics, for example, you're dealing with babies and stuff, the time that you're intervening is extremely important. And so if you have timely communication and stuff, that definitely helps, ladies and gentlemen. Of course, accurate communication. One of the things I say is that please check, double check, and recheck again. We are dealing with human lives. Relationship dimension. This is an interesting bit. Shared goals. Who understands what that means? CBN Clinic is an organization, isn't it? Okay? Everybody should know, hey, what is the vision or the goal of this organization? How are we all keen to it? What's our role to play in that shared goal? Okay? Once everybody understands that, hey, this is the vision of this organization, okay? Everybody now sort of understands that, okay, this is where I actually keen. This is my own role to play. Everybody within an organization knowing what the strategy or what the goal or what the vision or what the objective of that movement is extremely important, especially when we talk about the relationship dimension. Shared knowledge. Most of the time, you see maybe a nurse. When I started doing stuff in Garrett Hospital, in the ICU, I'll come into ICU and I'll say, hey, where is the nurse? And I'll ask the nurse, oh, how are things with the patient? What do you think? The nurse will be like, what do I think, a nurse? Oh, you're the doctor. Shared knowledge. Everybody almost knows about everything that everybody else does. Imagine someone who is in your customer service area. Do you think her work will be much easier and stuff when she's actually relating with people coming through? Everybody knows what everybody does, and everybody just interfacing. Remember, there's the violinists and the piano players and stuff in the orchestra. Okay, shared knowledge is extremely important. Extremely important. Nobody, when I'm doing ward rounds, sometimes when I'm in a difficult setting or something, I'll ask one of my juniors, I'll say, oh, what do you think? Look at me. I thought you're supposed to be the god, the neurosurgeon, the consultant. No, nobody knows everything, please. That's why shared knowledge, shared goals and stuff are extremely important. Mutual respect. I talked about it that when I got to the UK, I quickly understood that no, providing healthcare for patients is not about doctors. Sorry. For those who are doctors, sorry to burst your bubble. It's not about doctors. Yes, the doctors will lead the team and stuff like that, but everybody in that team is extremely important. Nurses, medical lab scientists, physiotherapists, radiographers, sorry, we cannot do without you. We cannot provide yours and that safe and quality care, okay, that is patient-centered without you. Nowhere in the world can it be done. So mutual respect, everybody understanding what everybody brings to the table. And like I said, everybody interfacing like this. Okay. You know, say for Nigeria, life hard. one of the things that I've seen is that culturally, it's just a situation where we just think that things must be difficult. Have you noticed? Yes. It must just be difficult. I can imagine people. I can imagine you who trained in Nigeria here. Your consultants and stuff who are training like, no, we must deal with him. It must be hard. No, it's not. That's why we have technology. That's why we have all these new things that come up to make life easier for us. Okay? So in 2015, I thought of this. The first principle: make things faster, make them easier, make them better, make them safer, and make them simpler. Usually, when I'm working with my junior doctor in FMC, he wants to write 1 million. I say, hey, bro, are you writing an epistle? It doesn't have to be that complicated. We can do this. We can make this faster, easier, better, safer, simpler. Guess what? When you actually throw in teamwork and multidisciplinary approach, and everybody respecting each other, everybody understanding what everybody brings to the table, everybody interfacing with each other, and everybody being in that state of that playing the violin and playing the piano and being in that orchestra. Extremely important. Next slide, please. Next slide. Okay, so I'm not cheating. Yes, sir. Everybody is always like, hey, especially surgeons. Let me see my power. You know, I'm a surgeon. I can operate and stuff like that. So there's a tendency for us to focus more on the technical skills here in this part of the world. You know, I see my operation, see this and stuff like that. One of the things that I tell people is that if you look at, for example, spine care in Nigeria, the technical capacity to actually go into theater, cut, do this and stuff has significantly improved. But guess what? The issue of patient safety and the quality of care is still down in the drain. People think that you just go operate on the patient, oh, operated, oh, super. No! Post-op care. So the key thing is we're dwelling too much on technicals. They're very important, they're extremely important. But guess what we lack badly across board in all sectors in Nigeria, unfortunately. Well, of course, in healthcare, it's really painful because we're dealing with life and limb, isn't it? Non-technical soft skills. I'm sure we've all seen those things on social media where a nurse will say, show me your yash now, show me your yash. You know, they're not compared with somebody who is in UK or US. They say, oh, hello, okay, can I just give this yash and stuff like that? like I said, you understand, when I got to the UK, communication skills, I was so irritated. I didn't know they were actually training me properly. Every time I'm seeing a patient in clinic, especially privately, the first thing they think is, why are your consultations so expensive? And then when they finish, they say, no wonder they're expensive. Because I communicate with them. So this non-technical is what I'm talking about. The issues of leadership and management. Being able to solve problems. Being able to look at how you can run things, build a service, cost effectiveness and stuff like that. Okay? And like I said, organization of service. Understanding the issues of patient safety and quality improvement. Being in a place, no matter how you think, oh, whatever kid that you are, looking at someone and saying, oh no, innovation, we can actually do this and actually improve things and actually, remember, the first principle, make things faster, easier, better, safer, and simpler. Again. In fact, I should just like communication. It's a big problem. Big problem across the world. Where do we start from? Okay, we can start from here and start talking about it at least. Okay? I talked about the multidisciplinary team work before. Okay, everybody is important, extremely important. Right? And then we now look at all the other things. You know, situational awareness. Anytime I'm in theater, that's one of the things, the first things I actually like to teach. You know, when you're in theater, hey, where's everything? The situational awareness. Oh, what's happening? Instead of having people playing on their phone and stuff like that, hey, everybody's needed. Of course, when you look at issues like emotional intelligence, social intelligence, all these are strategies in terms of enhanced communication. Extremely important. Next slide, please. Okay, so what are the benefits of teamwork and enhanced communication? Because everything I'm talking about, I like putting that communication in there. A team that is working well is communicating frequently, accurately, and in a timely fashion. They are communicating. In fact, that is one of the fundamentals of a team that's working well together. They are communicating. Okay? You will definitely get improved patient outcomes. Definitely. Definitely. Okay? Medical errors, negligence, these medical errors. Medical errors happen everywhere in the world, but guess what? They will definitely happen more in Nigeria because we have still not understood the importance of us actually working together. There are many times I'm operating. My parent hospital may say, hey, what of this and stuff like that? Because I've created that environment where everybody can speak. Because I've created that environment, I've not created that environment, oh, you know, I'm the boss. When I talk, because my word is final. I've not created that environment. I've created an environment of, hey, shared knowledge, shared goals. Do you understand? Everybody understands hey, orchestra, do you understand? We are all moving towards the same thing. And so, if my period nurse or one of the other people working with me sees the problem, they are so happy and confident to treat them and say, hey, I think this so. And I'm like, oh, thank you. No man is an island. That's what it says, isn't it? Of course, it will improve the efficiency of what you do. Remember, making things faster, easier, better, safer, and simpler. It will improve the efficiency of what you do. Why do we like hard life like this in this part of the world? Hard life. Of course, when you're doing all these things and stuff like the thing is that patients and their relatives, they actually feel some of these things. They can feel when the team that's actually working, providing care for them, like, oh man, these guys, they know what they're doing, even the way they talk to them. You can actually feel it. So of course, we're going to actually move to actually patient satisfaction. And guess what? When you actually are in that sort of environment, you know, where everybody is mutually respected, everybody understands the goal of what the organization has what the goal of the organization is. Everybody understands the issue of shared knowledge. Everybody understands what everybody's input is and all that. Okay, you're actually going to have more motivated people working in an environment of teamwork. More motivated. Sometimes we always think that that it's just the pay that we're getting, and that's the only thing that is driving people to go outside and get for example. No, the environment where you work is extremely important. That issue of you actually waking up in the morning and say, oh yeah, I'm all geared up, I want to go to work. The environment and the people you're working around and how you're actually working together is extremely important. Okay, we're talking about collaboration as well. Well, I talk about collaboration, cooperation, and partnerships. I call it CCP way. Okay, synergy. Integration, one of the major problems we have is that everything in Nigeria is just fragmented. CBN unit is doing their own. Those people are doing their own. And of course, you're wasting resources, you're duplicating functions and stuff like that. But in terms of course, supporting each other, next slide. But in terms of what kind of innovative strategies can we use? So, for example, one of the things I started doing over the last couple of months is that I actually have a bank of critical care staff. Okay, so if I have a patient to look after somewhere, I'm like, hey, there's this patient and stuff like that. Anybody wants to actually come on board like that? In fact, sometimes the ICU, there are many ICU nurses. They're like, hey, oh, sometimes they're asking me, oh, is there any patient to actually look after and all that? So actually having bank staff is one of the innovative strategies. One of the things I do is, we have some of this equipment and stuff. It's really for operations that are not too complex. Sometimes we actually move equipment. Move equipment from one place to the other, sort out the operation, and then move the equipment back. Okay. So I showed you a few things. I showed you us playing our own orchestra in the theater. I showed you complex brain surgery, complex spine surgery, isn't it? So how are we actually delivering this? Unfortunately for me personally, and leading the team that I lead, I've not been able to get one place where I can actually provide all the care for patients. Most of the complex surgeries I do privately. Okay, yes, I'm in FMC, Federal Medical Center. I started there in January, towards the end of January. Till now, I'm still struggling to actually get some of the equipment. I've done some basic brain surgeries there, okay? But most of the big surgeries I do, I still done privately. Unfortunately, most people can actually afford them. But how do I actually provide that? The theater itself is the place for theater medicals, okay? Everything you need to actually provide complex neurosurgical care is actually in that theater. But guess what? The post-operative care, I don't trust them. So I actually have to use an ambulance, move the patient, do the surgery, and actually move them out. Initially, I was actually looking after patients in Garrett Hospital. Me and them quarreled. As I was saying, I was a quarrel well. But now I now use a hospital called Mayfield, a massive hospital, somewhere in some city, but they do the post-op care. So combining facilities is one of the things that we can do. And of course, using technology. People simple technology. Like yesterday, the registrar was on call. Patient came into A&E. Lady in her early 20s was hit by a car, had some bleeding in the brain and stuff like that. Just simple technology. Can you just video the scans and send to me? So she video the scans, sends to me. I talk to her, and as I'm talking, I'm actually teaching her some things as well. What's the patient she sees? Class will come and speak. She says, this. I say, no, what is this and stuff? And I actually, on that WhatsApp chat, do this for the patient. And today I come in, patient is absolutely fine. Everything has been done. So even just simple technology can actually facilitate that as well. Next slide. This is something I like bringing up now and again because I'm talking about cooperation and collaboration, isn't it? It's just a question. Sure, a significant number of people will refer patients to India and stuff, and then the Indian people will give them. Oh, thank you. And they'll have referral bonuses and stuff like that. So why don't we make it official? It's just a question. Something else to think about. Instead of referring patients outside and stuff, if we can provide that care in Nigeria, and some people want to actually get referral commission and stuff like that. Let's think about it. Next slide. This is what I said at the beginning. If you have fantastic buildings, if you have all the equipment in the world, if you have all the technology, if you don't have the human beings that are working as a team and collaborating and stuff, is a total waste of time. So anytime where your governors and stuff are actually building things and coming to commission and say, oh, we have one big hospital here, just tell them to say, we are not impressed. Sorry. We are not impressed. The problem is that out of all these factors that we actually look at, the human beings are the most important. But that's is that part that they actually put less emphasis on. Just like in Nigeria, we always crude oil, stealing crude oil. Meanwhile, the human beings are the most important. What Japan and Brazil, what do how much crude oil do they have? So it takes more than this. Next slide. So everything we are all pushing, everything we're talking about today is about patient safety and quality of care. Okay? Patient safety and quality of care. By the time in this organization, CBN clinic, everybody's working together, everybody respects each other, everybody understands what everybody's bringing to the table. Everybody now knows that, hey, yeah, well, doctors are important, but others are very important as well. So that's where we want to actually move to. I want to move to this because, next slide, the Nigerian patients are worth it. Thank you very much.
So we need to start communicating.
Yes.
So how can we communicate now?
Okay, so that means within your own organization, okay, the issues of actually teaching soft skills and actually doing proper simulations is not a bad idea. That's number one. Within every organization, let every organization start and say, okay, we want to actually get people that will be teaching us these soft skills. Okay, what to actually do. Because guess what? It's all about practice, isn't it? I'm sure when I left Nigeria, I was like the average Nigerian as well, talking like this and stuff. But when I got there, I had to be myself and learn, isn't it? So it is actually, these are skills that can be learned. So if CBN training, for example, if they understand the importance of communication skills and teamwork and stuff, they will actually say, hey, where can we get people to actually come and teach us these things, do simulations and stuff like that. So that's something that you can do. Second thing is that all cadre and all different types of healthcare professionals, they go through some sort of basic training, isn't it, in medical school, nursing school, medical lab science school and stuff like that. Guess what? In terms of looking at their curriculum, the issues of management, leadership, soft skills and stuff, we must make it part of the curriculum. Extremely important. That's what we need to do. That's why we need governments that understand this, isn't it? We are going to do 28th of September now, where the campaigns are going to start. Nobody's asking these guys, what are we going to do about healthcare? And healthcare, guess what, is a mainstream public good. When the guys in UK, when they're doing their campaigns, healthcare must feature. When they're doing their campaigns in the US, healthcare must feature. In Nigeria, it's an afterthought. And guess what? Like I always tell people, the people are deserving of the leaders they get. If you ask the average Nigerian on the street, what are your issues? They're going to tell you about security, tell you about the economy, tell you about what else? Security, the economy, power, infrastructure. Nobody will tell you about healthcare. Nobody. And for me, that is a big problem. Sorry, I hope I answered the question. Yeah.
I don't know how we have water for him because the energy was really so much. Let's give him a round of applause. I saw the energy. I was like, man, if you are working in any hospital, the managing director or the medical director will be in trouble. So I want to thank you so much for the presentation. It was really worth it. We would like to take your indulgence that we will invite you again.
No problem.
Yeah, maybe this time we'll look at another angle about the how to this time. So leadership skills, all the communication this guy talked about, how to. So we'll just hit it on the nail on the head. But like, please, if you sit down, no worry, please. I like to usually, as part of our presentation, I like to also have somebody that's a kind of rapporteur who summarizes the whole essence of the presentation. It helps so that people when they go, they have some takeaway. I didn't remember on time, but let me just capture what he talked about. So, like I said, he came with so much energy, and he engaged us. We are all happy. Were we not?
Yes.
All right. So it talked about the topic collaboration and team work in patient management. Very key and topical, and you understand that we need it in this environment. He went to discuss the 6 pillars of health care, WHO standard. He talked about the facility, which is the building itself, workforce, the information systems, financing, leadership, governance, and things like that. And then we honed that. Okay, he took us through his skills. By the way, super skills, man. The brain surgery, the spine surgery, and all the FCC they do. I just felt like becoming a neurosurgeon. You know, so he has also sold himself. At least we know him now. I will know that these facilities and these surgeries are available. He has also told us the challenges. Part of what you know is that most of our spine patients, we send them abroad. And the reason we do that is really because of the post-surgical care. Most people have a fantastic surgery. We have the same problem with kidney transplants, even though these days we are beginning to see improvements. So that aspect of care, which is soft care and team building, is not there. So that's what we are trying to do. So he discussed about non-technical skills, which are the soft skills, which include leadership, communication, which I think we will need to dwell on. He talked about the FEPS principle. That is his principle. So happy to hear that. Faster, easier, better, safer, and
simpler.
You know, so that's great. So that's a takeaway for us. Then he discussed the benefits of teamwork. I'm sure we know, patients will be better, things will be, this FEPS principle will apply. Innovation strategies. With my colleagues, we are always brainstorming. This is a facility that is a little not outside the regular teaching hospital setting. It's also not a private hospital, so it's a mixture. So we have to have a hybrid, which is where innovation comes in. And one example he gave was, you do surgery here, you drive the patient to somewhere else when they will get post-op care. Fantastic. So you think outside the box, and then we grow from there. The issue of referral commissions and bonuses, also fantastic. We talked about it. So we need to begin to collaborate like that. And then it takes more than a facility or a building and technology to provide care. And then the main message was safety and the quality of care. So we want to thank you so much for the presentation. If there are any comments, questions, please let's feel free to spend the next 5 minutes in this discussion, okay?
Any comments? The things that excited me was I was going to come away from the traditional Nigerian hospital. I came from a teaching hospital, and I was very familiar with the problems. Extremely familiar, perhaps too much. And I needed a break from that environment. But I'm also not very keen on abandoning my country. So I was caught, and I said, what do I do? So I found myself here. And I was excited to see many young people like myself and an environment that, is better than where I was coming from. And I said, well, this is an opportunity for us to build the kind of care that people run out to do, to create the kind of work environment that as young people we are proud of. You are happy to come to work. I have a team that I work with. So I'm very happy to hear you speak. It's re-energized me, and I hope that we are also, each one of us has also picked that kind of energy. So thank you very much, sir.
Thank you.
So let's appreciate him.